Yeah, so just exactly like what he said, as soon as you take the scan, this screen pops up where you can do the different aspects of the scan. You can run the occlusogram tool through the viewer and have almost all of your picture-like images from there. Or you can click the one that says Invisalign Go Case Assessment. And then it runs through about 30 seconds of software and spits up the results on the screen. Just like your phone would, everything on the right is going to say, yes, this is acceptable for iGo, or hold on, it may be possible, but these are the limitations, or these are some of the things you need to check. Now, I think the coolest part about it is, not only are you staying kind of within that zone of things that are very, very comfortable to treat, but also you kind of have the expectations of knowing, giving the patients the right expectations without having approved a bunch of cases and know how many aligners it's going to be. You kind of have that idea for the patient so that they know, hey, it's going to be about this many aligners, it's going to take about this long.
Remember the two most common questions, right? How long and how much? You got to know how much, because Dr. Pope's going to tell you, or whoever you decide your fee structure, and you'll be able to tell them how long, because remember, this is all 20 weeks or less, right?
From here, being able to show everything you can do, the other cool part is you can immediately and instantaneously go to the simulation. So you can show the patient what's changed, and hey, this little tooth right here that was you were concerned about, this is what it's going to look like.
Go back to that last thing there. No, we had the arch together, the anterior view.
The simulation?
Yeah, both arches. I just want to show one thing here. Yeah, the anterior view. So look, if I just want to give you a little kind of like live role play here. So if you were my patient in my chair and I did a scan and I pulled this up, right? And I'm doing your consultation, I'm talking about your occlusion, right? Do you see how you can point out abfractions to patients? And you can start talking about whatever the problem is that created those in the bite. You can actually blow it up and show them really live, up close and visual. And that's when they really get it, right? And you start showing them these abfractions in live color in a different viewer. They see what's going on, and all of a sudden it doesn't go from like, you need to do this. They're asking you, what can we do about it? Like, that looks gnarly, doc, what can you do for me? Then you roll into, because we know what causes abfractions, right? Right? Yes. You talked about it? Then you roll into, look at the angulation your teeth are hitting on, this is why you're getting abfractions. And they're like, then what can we do about it? Well, we can use clear aligner therapy and put your teeth in better position so that they don't continue to get damaged with abfraction lesions. And we can do, there's a product we use called Invisalign, and they're like, let's do it. That's just kind of how it works. Thank you.
Mm-hmm. You want to see one that doesn't hit the right?
Yeah, but go back to the case assessment again. I wanted to show. So you guys, look at that case assessment. So remember when that part where you check off, like, what are your concerns? Like, so he checked off crowding as the patient's concern. And so look, crowding is solved easy. Everything is easy, right? And if it's all easy, it's going to say in green, treat or recommended. That's all it's going to say right there. If it doesn't say orange, or if it doesn't say green, it's going to say don't recommend it, and then you could push the refer button and would go to one of the other doctors.
You want to see what that looks like?
Yeah, we'll show you that. And then while you're plugged in, I want you to show them that time lapse.
So there it's what it's looked like if it says, hey, Invisalign Go treatment not recommended. Some of these different aspects are very difficult to be able to accomplish.
So you read what it says in that box down there. Based on the analysis of the patient's chief concerns, this case is too complex to be addressed by Invisalign Go. Refer to an Invisalign specialist is recommended. You would push refer. Now, if one of the docs that's done a lot of Invisalign cases saw that, or if that was in my chair and I just happened to do a case assessment, which I don't do, but I would not refer it because this is very easy to treat for me. So you can use this as a guideline initially until you've done, maybe a handful of 5 or 10 cases. But then after that, just because it comes back like this, you can look at it, like show the lower arch. What are they having difficulty with? Smile line, tooth prominence, crowding lower arch. So put the lower arch up. So what this is saying is it's basically telling you when you did the assessment, it's saying there's more than 7 millimeters of crowding. So remember what I said about how you measure crowding? So this would be like about 2 millimeters, right? And this would be another millimeter, and this would be another millimeter, and this would be another millimeter. So the software analyzes all that, and if it's greater than 7, it's going to say it's not an Invisalign Go case. What that means is that you couldn't fix that in 20 weeks or less. But you could fix that, Doc. How long would it take? How many aligners did that take?
Right.
Huh?
9 months.
How much?
9 months, so.
9 months, so 30, 35 aligners, something like that. So are you getting the distinction I'm talking about? The difference between a green movement versus non-green? Okay. All right. Travis is going to show you another little thing that we dipped into a little bit in the other room, the time-lapse thing, but I want you to see it on a big screen, what it actually looks like. And I use time-lapse for all kinds of reasons, especially in hygiene appointments. But it's really cool if you're doing an Invisalign case, and it's a mild case, and the patient comes to see you after like 10 weeks, and like, I'm wearing my aligners, but I don't think anything's moving. Because patients can't really tell if things are moving, because every day it's so slow and gradual, they can't see the distinction, right? You and I can, because we see them every month or 6 or 8 weeks. But if someone's like kind of giving you a little stink eye because they don't think their teeth are moving, I will just like go like, Kathleen, scan Tony over here, take her 3 minutes. And then before I come back in the room, she'll open time lapse. And then she'll say, Tony, you don't think your teeth have been moving? Right? I mean, it doesn't lie because it's going to digitally show them. So if you have someone that's got lower crowding teeth, do you have lower crowding in this? Or is this
this is my
it's just a
MLS
kid, yeah.
edition.
Well, you can put it right there. So you can imagine, put it over, now go over in the red, like right here, yeah. Yeah, that's cool. So you can imagine that if you were, that doesn't really show me because it's no move. But if you were treating a case that had some lower crowding, and the patient said, I don't see my teeth moving, but all of a sudden you do this time lapse and their teeth go like this, and they're like, right away they go, oh wow, I didn't realize my teeth have really moved a lot. It's just kind of a cool thing to do.
Sometimes it's just because of where they're at the stage of treatment. You might be broadening things out before you tip out the lowers or
Exactly.
Because of the staging of the sequences of the planned movements.
But remember, anything that's changed is going to be in what color?
Right.
So all you need to do is put it over something red, and you see how it shows the change? So it's really a cool thing to do. And like I said, I use it in hygiene a lot for recession or abfractions, or if a cusp is wearing out or if something's been broken. What? Why are you smiling so good?
We're just watching.
Ooh, let's wake him up. Listening. Okay, all right. I think that's cool. Let's plug back in.
Top one.
Thanks. Oh, that's weird. Hey, Travis.
Yes, sir.
You see this enable button?
Yeah.
I wonder why I can't get that off.
Control delete.
It's not showing me on my thing. Time out, you guys.
You can try Control Alt Delete and then Task Manager.
Oh, okay. Control Alt Delete on an Apple.
It's Command
Ooh, was that?
It's an apple.
Ooh.
Yeah, I think it's command, it's the same thing, I think.
What is it?
It's just command instead of control, I believe.
Command option escape.
Command, what?
Alt delete.
There's no alt on an apple.
Command option escape.
Control.
Command option escape? There's no
Yeah.
escape. Command option delete?
There's no escape.
Where's mine?
Everything.
So you don't see that on your screen right
Perhaps if
now?
you click cancel. Escape is upper left.
Escape is upper left.
Who knows Apple? Come do it.
I'm not command option escape.
We have to get this off, otherwise it'll be in the middle of our screen. See, it's not showing on the screen.
Robert.
Yeah.
Command option escape.
Go back to command option escape.
Yeah, what's escape? What's the escape
You
button?
have the bar, the light up bar there, right?
Yeah.
It's probably on there.
It's not. Oh, there we go. Wait, let's.
It's how it's displaying.
Okay, we got it.
Now, how many monkeys?
No, we don't. Oh, wait, stop.
This is take to fix.
Not as easy
Yeah,
as.
'cause that-
It's just click to enable.
Okay, where were we on that? Okay, so we did the pictures to be able to do the case analysis assessment. We showed you how to do it just now on the scanner. The other way would be if you wanted to use impressions. But remind yourself that if you use impressions to get a case assessment, it's going to take weeks. Because you got to take them and mail them in. And then you got to take pictures and put them on that prescription thing there. And then when they get the impressions, they'll do the assessment, you'll get an email, and then you can see it the thing, right? It's much easier to do pictures or a scan. But the opportunity does exist to do it with impressions. So let's say you're going to do it with impressions, because you guys don't have scanners and you don't know how to work your cameras. Because you're not a good monkey. Okay, so we're going to add a patient. This is on your doctor site. Add a patient. This is how you do it. Patient's name, gender, date of birth, zip code, and which doctor office address you're working in. That's it. First page. Second page, what are your concerns? What are the clinical conditions? Is the patient worried about the spacing? Are they worried about the crowding? Is it a prerestorative case setup? Whatever it is, this is where you click on that case assessment thing. Then you're going to take some pictures. And this time, you're going to take good pictures because you know how. And then, because this is a mail-in case assessment, if you're not using the photo uploader, you've got to put these computer pictures on your computer, and then you have to drag them in from wherever you've got them on your computer into this site here to then upload them like this, and then push start the assessment. You see how much more difficult it is to make this way? So you do the assessment once you got the pictures in, yeah.
So on the first way, or even here, I don't see anything where it asks you, are there any dental implants in the photos?
We haven't got there yet.
Okay, all right. But we've already went through the monkey way already and it didn't pop up anything.
Yeah, we haven't got there yet. I'm going to show you how to do it. The monkey thing. Chief concerns, right? Comes back green, you're doing it. Comes back orange or red, you're referring it, or you're doing compromised treatment, or you're switching product. I don't want to get into this too deep, but where's Dr. Pope? Dr. Pope 1.
I'll mimic him for now.
You've done a better job than he's done. If you have a patient that needs to be referred, you push that button. You guys will be able to set up a referral source inside your groups that will have your name or his name or your name, and their referrals will go right to your doctor site, and you can choose whether or not you want to do the case. It's going to have enough information on it that will be appropriate for you to actually get the pictures and the scan and the assessment that they did. So you don't have to redo it all, right? So you can just look at the case assessment and the pictures and you can say, I'll do it or I won't. And it's going to have all the information built into it that they put in like the patient's name and address and zip code and all that stuff, it's gonna come right to you, so you won't have to re-enter it. Like I said before, if it's too difficult of a case, you can also select to case switch it and do a comprehensive case. I don't really want to get into this too much because I don't want to confuse you. But when you do a prescription, you just ask, how do you know if it's an implant or stuff? We're going to go through that. If you do a prescription for Invisalign Go, it's a clear aligner button that you would push. Once you push the clear aligner button, then you're doing a regular type case. If you want to do an Invisalign Go case, you would push the Invisalign Go aligner button. You see that? So if you wanted to switch the case to comprehensive, because it's going to take more than 20 weeks, this is where you would do it. You would push Invisalign Go aligners on an adult or a teen or a child, and then you would move to the next section, which you would select what type of treatment you want to do. So like right here, these are our different products. If you're switching products like Comprehensive, Light, Express 10, Express 5, Express Package, those are all like you were just asking, who was that was asking about the different products. So we have like a ton of different products you can choose amongst to treat your patient. But right now, you guys are just focusing on Invisalign Go. Okay? So, how to submit an Invisalign Go case. Prescription form. Remember, when you fill out the patient's information on your photo uploader, it's going to go right here already. So you're going to open your doctor site, and you're going to see that Mrs. Test 3's information already is going to be here. And all you're going to do is push start, like a monkey. Start. You're going to push it's an adult patient, like a monkey. You're going to push Invisalign Go, like a monkey. You're going to push Invisalign Go Adult Select, like a monkey. Has it been confusing yet? Push Invisalign Go again. Now you have to use your brain a little bit. But we have bananas behind each option. So, which arch are we treating? Either just the upper, the lower, or both. Select both. Boom. That's question one. There's only 4 questions. Remember, simple. First question, which arch are you treating? Upper, lower, or both? Second question, to answer you, tooth movement restrictions. What are some things that we cannot move in patients' mouths?
Ankylosed tooth.
What?
Ankylosed tooth.
Implants, yes. Don't read it, you know it.
Oh.
It's monkey, remember? You can't move implants, can we? Only Smile Direct Club can move implants. We don't know how. We haven't figured it out yet. What else can't we move? What else can't we move besides implants? Bridges. If you want to move a bridge, and I do it often, what do we do, Doc? We section the bridge and move the abutments individually and then redo the bridge when you're done with the treatment. Don't let a bridge lock you out of getting someone to help you
You
fight.
put a Pontic in the aligner each time?
Huh?
You put a Pontic in the aligner each time?